You guys.
Yes, hi.
Great.
Yep, I'm here.
And Anjana, I know you're here. So, I think with that double check, uh, we are ready to get going. And so I wanted to, first of all, say thank you for joining us here in this conversation. We're excited to begin this national dialogue around the intersection of workforce development and the facets of early childhood education and how we can work together to make that a stronger system. And so joining us today is Rachel West, who is Special Assistant to the President on Workers and Jobs. And she was the one of the primary authors on the executive order that was recently issued. So I wanted to hand it over to Rachel and we'll get started here.
Thanks, Tracy. Thanks so much to everyone for hosting me here. Wanted to say a few words up top about the administration's recent actions on care, which sort of underscores why we're so grateful to see groups like this coming together to talk about solutions. So this is one group, doesn't need me to tell you that we're in a care crisis, that's for sure, that, high quality care, it's really costly to deliver, it's really labor intensive, it requires skilled workers, and yet those very workers, mostly women of color, they're among the lowest paid in the country. And at the same time, on the other side, the price of care is really breaking the bank for a lot of families. So this administration has really put affordable, high quality care front and center as a huge priority. The president's budget, for example, really puts money where the mouth is and calls on Congress to invest $600 billion over 10 years in affordable, high quality childcare and preschool, $150 billion in Medicaid home services, and that's just a down payment. But the administration, decided that this is too important for Congress to wait on Congress to do so. In April, the president signed the CARE executive order that calls on federal agencies to really do everything in their current power to improve lives right now. So that EO, which I encourage you to take a look at if you haven't already, it's got more than 50 directives that cross nearly every federal agency to help address childcare, long-term care, and the crisis that we have in these systems. There's a lot in that EO that makes care more affordable. It increases supply of care. It would improve job quality for care workers. Everything from ensuring that a greater share of our Medicaid payments go to reach workers, to piloting mental health services for Head Start teachers and improving home-based care for veterans. But since we've got limited time today, I just wanted to highlight a couple of things that this group might be particularly interested in and make a couple of asks to all of you. So first, the EO really builds on the historic CHIPS funding opportunity from the Department of Commerce, which requires major grant applicants to ensure that their workers have access to affordable childcare. So what the EO does is it says to federal agencies, particularly those with funds from the president's Investing in America agenda, that they'll need to identify which of their programs can support care for workers who are delivering on federal projects. So that means they'll need to consider requiring or encouraging applicants who are seeking those funds to expand access to care for their workers. We're really early stage of implementation here, and this will look different across agencies and it'll look different across programs, but it's critical, and agencies recognize that, to building a skilled and diverse workforce. HHS and DOL, they're already working on the guidance that they're directed to produce to help applicants understand really strong models for providing care. But my ask to you is that when you identify good and innovative approaches that employers could take to help their workers access care, including partnering with local workforce boards, with funders, with community-based organizations and others, we want to know about those models. In the White House, at HHS, at DOL, we want to know. And that particularly goes for rural areas. There are going to be a lot of, bipartisan infrastructure law, CHIPS, IRA investments in those areas, and they experience particular constraints, as all of you know. Second thing the EO does is it directs DOL, HHS, and other agencies to really lean into registered apprenticeship and other high quality, free and affordable career pathways for care workers. So for instance, DOL will prioritize the care workforce with its $85 million state apprenticeship grants. But care work, it's not the building trades where apprenticeship has been around for 100 years. We are still really learning about which earn and learn models, which innovations can work in home care, in healthcare, in child care, especially those with wage progression and job quality. So a second ask to this group, innovate, test, pilot, and send us strong models. That's what we need in this space. There is a ton more to dig into in the CARE EO, so I will just say by way of closing here, the EO is not a substitute for congressional action. It is not a substitute for the massive investments that we need to fix a broken system. But what it is a recognition that our care crisis is really deep. Families, workers, businesses, folks receiving care, they are hurting, and that we cannot wait to address it. And so we are looking to you all for innovative approaches from the bottom up and for your feedback on these actions. So thanks again for hosting me. Looking forward to the conversation, and back to you, Tracy.
Thank you so much, Rachel. I really appreciate you joining us today and sharing a bit of an overview on the executive order. We did share that, and we'll share it again after this conversation so that folks can get familiar with it. And we will definitely make sure that we're sharing what we're learning and seeing and testing and modeling so that we can continue to advance the improvements that we need to see. Next up in the conversation is Congresswoman Bonamici, from Oregon's first congressional district. And I hope she's here. I know she was having some challenges with getting.
I am here. Can you hear me?
Yay. Yes.
Oh, terrific. Great.
Thank you.
Wonderful. Wonderful. Well, thank you so much. And thank you to the administration and Rachel for your remarks. And thank you for the invitation to join you. I really appreciate the opportunity. I know that you bring a critical perspective to really focus on the challenges that are affecting the childcare workforce. And again, thank you to Rachel for highlighting the work of President Biden and his administration to tackle this crisis in the care economy, which is something that, we had challenges before the pandemic, and then they were exacerbated, of course, during that time. The executive order is an important step. It's removing barriers to access federal assistance and also enhancing workforce protections, really important. But we need resources from Congress to deliver on the promise to support caregivers. It's something that I've been working on for a long time, and I recognize, for example, in the CHIPS and Science Act, for example, implementation requirement for companies that receive funding is to provide childcare. So it's in places like that where we're really going to see a difference in integrating this into our policy. So in Congress, I'm committed to building an economy that leaves no one behind, and caregiving is a real part of that. As a leader on the Education and Workforce Committee, I know the value of workforce boards to promote and sustain and grow our regional economies. We have some great work happening in Oregon. I want to give them a shout out. And I recognize the leadership of MUS in tackling the unique barriers like childcare that limit the ability of parents and guardians to return to the workforce. We hear about it in our districts on a regular basis, and it's really important. And I know you have this equity lens to look at evidence-based solutions from the workforce boards that are responding to the local needs with that equity lens. Thanks to Tracy. Thank you for your leadership at MUS and for the invitation to join you today. I look at childcare as basic infrastructure. It's important for children, for families, but also for the economy. And we saw firsthand how difficult it is right now for the childcare workforce and early childhood educators. I visited Neighborhood House in Portland, Oregon, and Neighborhood House has been providing high quality early childhood education programs for decades. In fact, it was one of the first Head Start preschool providers in Northwest Oregon. And when I visited the the center, multiple classrooms were closed because of staffing shortages, and they had a long wait list of families in dire need of care. So we know the need is there. We need the workforce. It's not unique to Oregon. Nationally, millions of childcare centers are understaffed. As much as 30%, there's as many as 30% of Head Start staff positions are unfilled. So as a mom, even though my kids are grown, I know how important this issue is as a mom, as a policymaker. We understand that children grow and thrive when they have access to high quality care and early childhood education, which I submit is the best investment we can make in our children and our families. So we know the challenges, but we also know the benefits. So putting those together, accepting the challenges and knowing the benefits, we have a responsibility to act. So we made some progress in the last Congress. We came close to advancing transformational investments and policies, and we're going to continue to build on that momentum. I'm seeing that this issue comes up in lots of meetings in places where we wouldn't have expected it before. So I led nearly 150 members in advocating to double funding for the Child Care and Development Block Grant. This is funding that can help families afford childcare, but right now it only reaches a fraction of kids who are eligible. And I'm grateful to see that President Biden's budget follows through on another effort that I've been leading with Representative Sarah Jacobs to include transformative investments in universal preschool and childcare. It's the largest budget that any president has recommended for early learning. I applaud the president and the administration for recognizing the importance of that investment. And I'm committed to securing funding and these overdue investments, and also working to pass some common sense solutions to expand the federal focus on care. I've taken over the bipartisan pre-K and childcare caucus, which I'm co-chairing now, and hoping we can find some common ground to support kids, which we know also supports families in the economy. So I'm going to be introducing my Building Housing with Care Act. So I'm reintroducing this. It's on the plan for tomorrow to connect affordable housing and childcare. So this legislation will provide $500 million to support affordable housing and childcare access. It recognizes the need for home-based care providers to meet needs as well, especially with after-hours care. It invests in technical assistance to help with licensure, something that my Child Care Advisory Committee has mentioned on a somewhat regular basis, but also we need a living wage for all childcare providers. And early childhood educators, they need to be compensated for the value of their work. And according to a recent report from the Bureau of Labor Statistics, there are about 100,000 fewer childcare workers than there were before the pandemic. I just want to repeat that, 100,000 fewer childcare workers now than before the pandemic. We already had challenges before the pandemic. And I know from my advisory committee and from talking with people who work in this field, childcare workers are pouring their heart and soul into the important work of caring for the next generation. And they're backed up by their skills, their expertise in the field, but oftentimes they're making near poverty wages, and many of them can't even afford childcare for their own family. So that's a serious gap in need. It jeopardizes the financial security of workers, but also the economy. Our wages are disproportionately harmful to women, especially women of color who make up a large portion of the care workforce. So again, that equity lens there, but we must find solutions that fairly compensate the childcare workforce for that highly skilled and complex job that they perform. And increases in childcare funding have the potential to substantially increase the workforce participation and employment rates for low-income mothers in the United States. And a recent report by the United States Census Bureau found that childcare subsidies help working mothers stay in the labor force and narrow the pay gap between spouses. So we know it works when we have affordable, accessible childcare. And I just want to note, there really isn't a market solution to this. We can't raise the tuition so we can pay the providers more, and we can't lower the providers' pay so we can make it more affordable for families. It must have an investment, so I'm committed to that. I'm committed to this greater investment. It means we're going to make changes that will improve the quality of childcare for all children. We also acknowledge that childcare providers are essential to our economic well-being. We support working women and working families. So I urge you to stay committed. We need your voices. We need your expertise to help solve these workforce challenges. And it is a workforce challenge, but it's also a challenge that's affecting children, families, and the economy. So I look forward. I guess I have time to take some questions. Is that right? A bit of time for questions, and thank you for the work that you do.
Yes, we do have, so we'll have a few minutes here for questions. So if folks have some questions that they would like to ask of the Congresswoman, please go ahead and either just raise your hand or drop it in the chat, and we will watch from there. I think,
Thanks, Tracy.
yeah, absolutely. One of the things that I know that we have seen come out of many of these conversations we've been engaged in is the importance of partnerships in really addressing this challenge. So when we think about the CHIPS funding that is going out for those semiconductor facilities, that's really important work. Reshoring that manufacturing is really important, but having access to quality care is also important. So
Absolutely.
I just think it's important that we really stay focused on that. I see Ruth has a question.
Hi, Ruth.
Hi, thanks for taking my question. Ruth Schmidt, Wisconsin Early Childhood Association. So a couple of things that, as I'm listening to this conversation, that strike me is we've talked a little bit about or heard from you about processes by which companies, corporations will be held to needing to provide care for their employees' children, right? That is one of the strategies that we're looking at. And so one of the things that concerns me, I think, whenever we have these kinds of conversations is when you have a limited workforce and it remains a limited workforce with incredibly high turnover, some would say we have a workforce exodus in the field of early care and education because the wage structure is so low, because there's no access to benefits that most of us take for granted. When you have discussions about businesses starting up shiny, new, bright childcare programs, we see exoduses from other childcare programs to take those jobs. And what we need is to be able to fill the vacant classrooms that exist already in our country with qualified teachers to provide that work so that those communities all across our state and our nation are able to serve children and families. And the need for this to be a net revenue gain for the field of childcare. This is not just a shifting how we pay for care, but it is shifting how much money goes into this industry. So I'm just putting those out as sort of concerns and looking for feedback. I know, I've seen what Patty Murray and oh goodness, in the representative, the reintroduction of the Child Care for Working Families Act. I've seen the introduction of Senator Warren's new plan. I think both of those bring with it strategies for compensation initiatives for this field too. And just wondering if you can comment on any of that and ways that you see us being able to advance that.
Yes, thank you, Ruth. And yes, we of course have had those conversations, and it just highlights the need to get more people into the field. It's going to require working with workforce boards, with our community colleges and other places to facilitate people getting into the field. And we recognize that, but it's an important conversation to have. As I mentioned, we want to have flexibility because some people use home care as well, rather than what you said, the big new shiny centers. We need to bolster the workforce in all of those areas. So all that we can do, and I know that Senator Warren has a proposal out. Senator Murray's been working on this a long time as well as we are in the House. So thank you for highlighting those issues. That I mean, to me, it just emphasizes the need to get more people into the field, and by raising the pay and also respecting the profession, we'll be able to do that.
Sorry about that, guys. Joys of technology.
Hey, Tracy, there's a question in the chat.
Okay, great. Thank you. Go ahead, Robin.
Star Morgan Schaefer, I think that's the way you pronounce her name. In order to gain more respect for the field, we need the Department of Labor to recognize early childhood teachers as a professional career. When looking at what qualifies as a professional career for salary and exempt, non-exempt status, early childhood education teachers are excluded.
I
So,
appreciate that.
Yeah, it was a comment, I think.
Yeah, no, I appreciate that, and it's something that we're working on. I did want to note as well that we have some proposals with the president's budget, calling to invest 600 billion over 10 years. I'm committed to partnering on that, and then I also am co-sponsoring the bills that Kevin mentioned.
Yeah.
We're doing everything we can here to try to get this through both chambers and signed into law so that we can really start making a difference. And I think I want to emphasize again, and thank you to STAR for that. We can start working with the Department of Labor on that. But I want to just emphasize that all of that you're doing and highlighting this issue, whether it be with your representatives or senators, is helping. But the conversation is coming up, as I mentioned. When I speak with business groups, when I speak with, community leaders, when I speak with elected officials at the state and local level, this is really, I think, a renewed conversation. I'm an optimist by nature, and I think the fact that the conversation is coming up, there's more recognition of the need to fill the childcare workforce and to put the equity lens on it as well. So, thank you for all you're doing. Let's see. Ruth asked, what are the most promising bipartisan childcare proposals advancing in the House? We're not quite at that point yet. We're still working on getting a lot of these proposals to be bipartisan. There is a recognition on the other side of the aisle of the importance, but we're working on making these bipartisan. We need to get them through.
Yeah, Congresswoman, thank you so much for fielding questions with us and for joining us in this conversation. We will definitely keep you looped in as we continue forward. This is the beginning for us of really advancing this national conversation. And so we really are grateful that you were able to join us. And one of the things that I want to point out, and I think folks will see this as we go through the agenda today, we really do see this as a collaborative effort. There is no one policy, no one funding mechanism, no one person, no one department that can solve this problem. This is a problem that requires business engagement along with government engagement and philanthropy and community organizations, etc. And so we will look to you, Congresswoman, for leadership, and we will support the work that you're putting forward as well.
Thank you, Tracy.
Absolutely. And
we'll let you know. And I just want to respond. Somebody put a comment in about what steps can we do to help make them see early childhood educators are teachers and should be treated as such. I have a child care advisory board, and I put out a report, and this is, I believe it came out pre-COVID, where we mentioned, there was a quote from an economist there talking about the return on investment. If we look at investing in our children, and for every dollar spent, how much comes back from that investment, and talk about, not just a place to take your kids, but a place to educate your kids. I think that will help in the conversation about treating early childhood educators as teachers. We also need, I just came from something on the Education and Workforce Committee. We also need to make the path, a lot of the childcare centers have, for licensure, require a college degree. If we don't make higher education more accessible and affordable, that's hugely problematic. And we know that, other workforce programs as well and other paths, but it's all part of the way we solve this. And thank you, Andrew. My staff has put a link into my child care report, my other work to address the care economy. And I'm sorry, I have a meeting waiting, but thank you for all your work and advocacy and for the invitation to be with you today.
Thank you so much for joining us, and we will make sure to share this out.
My honor.
All
Thank
right.
you. Take care.
Bye-bye. All right. So thank you all for that conversation. Let's keep it going. Next up, we have Kim Burgess Sims and Martine Gordon from the Administration of Children and Families. And we're going to have a bit of a conversation here around continuing that federal investments conversation and some of the resources that are landing in state government and available and accessible to those programs and practitioners. So I'll hand it over to Kim and Martine.
Thanks so much, Tracy. Thank you all for.
Hey, Tracy, there is one more, there's a couple more.
Okay, but why don't we hold on that, Robin, and we'll come back, okay?
Thank you all so much for having us today. I'm Martine, and my colleague Kim is here as well. I'm gonna kick us off for a little bit and then hand it over to Kim. So I'm a senior advisor for early childhood development in the Administration for Children and Families, which is in the Department of Health and Human Services. And so Administration for Children and Families houses a lot of the human services programs within HHS for the federal government, and that includes early care and education supports. You heard from Rachel West about the administration's dedication to early care and education, and I'm very happy to be with you here today. I know Kim is as well. And we're going to walk through the early care and education workforce efforts we've been able to push forward at the Administration for Children and Families so far. The good news is that what we're presenting today is just the beginning of the over 50 executive actions in the executive order Rachel mentioned. A good portion of those actions are being led out of HHS, the Health and Human Services Department, and specific to childcare, early care, and education out of Administration for Children and Families and out of our team. So we're looking forward to getting back to you in a few months to be able to, you can all hold us accountable to make sure that we're doing a good job on these things. Anita, Kim, I think we can probably make these slides available to you after the meeting. Yeah, that's not a problem. Before I move on, there was a question, Ruth had a question about the CHIPS NOFO. Kim in particular, I and a couple of others on our team had the benefit of working with some of the Treasury staff. This is some little behind the scenes information for you. They did put out a CHIPS for America workforce development planning guide that potential applicants would be able to have access to. I think Kim just put it in the chat. This is a Treasury Department. It goes with the notice of funding opportunity. So it is not from Administration for Children and Families, but we happen to know that in that guide, opening a new center is only one of many options, and applicants are really encouraged to do a community needs assessment of what their employee needs are and what existing childcare programs and resources are already available in their communities that might support those needs. And we had a lot of conversations with Treasury staff about that. So if that helps to add a little bit of context, doesn't solve the problem, Ruth, but the program guide does encourage applicants to do that needs assessment and really make sure that they're using existing programs sort of before they go out and try to start a new program that may not meet their employees' needs. Great. So now I'm going to go back to my programming. So this is, we at the Office of Early Childhood Development at the Administration for Children and Families. Our office includes the Office of Child Care, which administers the Child Care and Development Fund. Those of you in the child care space, you'll know this as the child care subsidies. It does more than that, but generally that's the funding that states, territories, and tribes use to develop their child care subsidy program. The Office of Head Start is also on our team, and that administers that federal to local Head Start and early Head Start dollars. Preschool development grants birth through 5. This is funding for states and territories to enhance their early childhood systems. We're going to talk about that a little bit. That's also on our team. And we also are the home to tribal home visiting. So we all work together to advance an early childhood sector that meets the developmental needs of children and families in their communities. That's our mission. And what I want to highlight about that and how we're trying to meet that mission is that we're really working to create opportunities for both children and families and the early care and education workforce. And we believe very strongly that we cannot address the needs of families without considering the folks who partner with them every day and make sure they have what they need. So there's a clear focus at the Administration for Children and Families, at HHS, and as I think you've heard all the way up to the White House, that I think Rachel's remarks made clear as well, that we are in a mission to support kids and families, but and also the workforce right now. I can go to the next slide. Thanks, Kim. So the federal government invests over $20 billion annually in early care and education. Unfortunately, you all know that that's not enough, and that only reaches a small portion of our young children and their families. Kim is going to walk through some funding opportunities that have became available through the omnibus bill that was recently passed. She's going to do that in a minute. I'm going to start with a little bit about the American Rescue Plan Child Care Stabilization Funding. For the past few years, this funding has quite literally, I'm sure as many of you know, helped childcare providers keep their lights on. And these funds have really helped also support the childcare workforce. And as you know, when we say childcare workforce, this is administered through the Office of Child Care, but a lot of these programs are, consider themselves preschool, early care and education more broadly. So it may have felt like the American Rescue Plan Act was passed a while ago, and it a few years now, but there's still resources going out the door into communities. And so as you'll see on this slide, to date, stabilization funds have helped more than 220,000 childcare providers with the capacity to serve more than 9.6 million children across the country. If you can see into these little boxes, you can see the number of providers supported in a given state or territory on this map. And the Office of Child Care also has released state profiles with more information about how funds have been distributed in each state and territory as well, and that's on their website. But what I want to sort of hit home, I mentioned that providers needed these funds to keep their doors open and to pay their staff. And some states are still distributing their stabilization dollars. And states also have supplemental funds that started to roll out after the stabilization funds. And those can be used to invest in the workforce as well. And those funds can be used for recruitment, retention efforts, and staff development. If you go to the next slide, we're really, with the focus on workforce today, we really wanted to sort of pull out some stats on how these funds have helped states to support their workforce. So many states are using these funds to increase child care subsidy payment rates and improve payment practices. And we know that that helps providers be able to, among other things, increase their staff payments. There are also states using these funds for retention and recruitment bonuses. You're seeing some fun stats on these slides. We also know that over 100,000 childcare workers have received some form of increased compensation from these. I'm sorry, I am saying the wrong number. 650,000 childcare workers receive some form of increased compensation from these funds, which we're really pleased to see. Some examples of some efforts underway to improve compensation from across the country include increased pay for the workforce in DC and New Mexico. Washington State has invested in premium-free health insurance access for its childcare workers. Kentucky is improving access to childcare assistance for its workforce themselves. There are also a number of states increasing funding for scholarships and tuition assistance. As we just talked about, making sure folks know that outside of the field that this requires a lot of degrees and credentials, as you all know, and so making sure that folks have the ability to obtain those. As I mentioned, there are funds still available and states have a good amount of discretion with how to implement this funding. So if it's helpful when you're engaging with your state leadership about what federal funding is and how your state is implementing it, know that you can please reach out to us, or as Rachel said, if you have ideas or examples that you want to share with us, we're very happy to hear those. Our teams across the board offer a lot of technical assistance to our state grantees on how to use this funding. And I'm going to turn it over to Kim from here to talk about some relevant guidance on the workforce that we've been distributing and other funding opportunities and resources that are available right now.
Thanks, Martine. Yeah, so in addition to technical assistance, we at ACF have released guidance, a lot of guidance, as you can see on this screen, for your reading pleasure, to really, from the guidance that came out with the American Rescue Plan to specific program guidance. This last fall, we released, actually in the same week, guidance across childcare, Head Start, and preschool development grants, highlighting ways that those funds can be used to support the workforce and encouraging strategies that are promising. We also have been putting out Dear Colleague letters pretty frequently over the last few years to try to really push bold investment in the workforce with the funds available, and really highlighting the local and state strategies that are underway. As Martine said, there's a lot of change and innovation happening right now because of the issues that have become so apparent during the pandemic and beyond. And so we're really excited about the progress and the innovation that's happening while we also are grappling with this big challenge. So I hope that some of those resources you all have seen. If you have not, I think it's helpful just to know that these funding sources are fairly flexible. The same week that we announced or released these guidances, we also announced a new funding opportunity for preschool development grants and Birth to 5 that states and territories can use to do planning and then build strong workforce initiatives and sort of systems changes across the whole mixed delivery system. And so we're really excited that those grants, those new awards were made, and we're seeing a lot of really exciting new efforts there. So hopefully some of you are tapping into that work or involved in it. And in March, our most recent Dear Colleague letter highlighted new fiscal year 23 funds that can support and sustain workforce investments. So I'm going to talk through a few of these, as Martine mentioned. So as the Congresswoman alluded to, we were really excited to see that CCDBG did receive a $1.85 billion increase in the omnibus bill. And we don't consider these one-time funds. These are funding that have passed through the regular appropriations process. So that's exciting to see. And states have a lot of flexibility in how to use those funds to support the workforce, improve subsidy payment rates. We're encouraging that. We're also encouraging that states use a cost modeling approach to pay subsidies based on operating costs rather than a market rate survey, because those market rate surveys simply reflect low wages back to you. And so using a cost model allows states to really build in the cost of quality, fair wages. So that's really interesting to see. In Virginia, New Mexico, and DC have already done this, and we have a lot of tools available for states who want to learn more about that. But there's a lot of opportunity here, as you see the strategies that were highlighted in our guidance, to invest in post-secondary education and training, apprenticeship programs through CCDF funds. Head Start also received an increase in the omnibus, a total of $960 million for a cost of living adjustment, and importantly, $262 million for existing programs to increase quality. And we're really emphasizing through our program instruction around that programs focus on increasing compensation for staff. We're also excited about the Tribal College and University Head Start Partnership Program. These allow tribal colleges and universities to establish partnerships and sort of build that pipeline of Head Start staff. We're learning a lot from these efforts, and I think a lot of the work there is applicable to other communities outside of just tribal. And so we're excited there will be some new funding available for that to expand that work. And as I mentioned, in January, ACF announced awards for 42 states for the preschool development Birth to 5, totaling nearly $300 million. And there was an increase in the 23 budget of $25 million for PDG Birth to 5. So there will be some opportunities for states to sustain or expand on these kinds of strategies in the coming year. In the past, these funds, these are really important. Part of the idea behind preschool development grants is that that states are really systemically thinking across agencies about how to work together to support the ECE system. And so I think the workforce systems change that can happen with these grants is really important. And states have used these grants to focus on compensation and benefits and more accessible and inclusive pathways for workers. So we're really excited about some of the plans that came in with the applications. A couple examples, West Virginia got their first preschool development grant, Birth to Five planning grant, and they are planning to sustain some of the retention bonuses that were originally funded with the American Rescue Plan. That they plan to reach almost 5,000 educators with those bonuses. Montana is offering mini grants to providers to implement innovative recruitment and retention strategies in underserved communities. Ohio, I know, is leveraging these funds to engage businesses and childcare partners together in a public-private partnership to boost wages. And we know that at least 9 of our renewal grant states are either creating new or building and expanding registered apprenticeship programs. So those are just a few examples. There's a lot of opportunity there. And then I'm really excited that we announced the launch of a new National Early Care and Education Workforce Center in February. The Workforce Center is a $30 million investment to support research and technical assistance for states, communities, territories, tribal nations to improve recruitment and retention of a diverse and qualified workforce across ECE programs. It was clear that we really needed a dedicated and targeted effort in this area. We've got a lot of technical assistance across our programs to support the workforce, the Head Start workforce, the childcare workforce, but this is a really unique effort to bring together funding from multiple programs to create a dedicated fund for research and technical assistance and helping states and communities and programs build a career pipeline for the ECE workforce who are pursuing credentials and degrees, maintain the diversity in this and sort of strengthen the diversity in the sector, and implement more sustainable approaches to increasing compensation and benefits. So this center will be led by Child Trends with their partners at the BUILD Initiative, the Center for the Study of Child Care Employment 0 to 3, the University of Massachusetts Boston, and the University of Delaware. I'm a federal project officer for the center. Their first year activities are still under development, but they will be doing some public facing events in the coming weeks and months. So I hope that you all can tune in for those. We'll be sure to share information in the chat also. They are going to be focused on a number of different things. As I said, it's a pretty big charge that they have, but they are going to be providing expert guidance in peer learning communities of practice on wage and salary scales, partnering with higher education, using workforce data, improving working conditions. They'll be creating new user-friendly tools and resources and building a new interactive resource hub that shares existing products and also highlights evidence-based strategies. They'll be doing some topical campaigns and of course continuously learning. So the idea is like learning from the work that's underway in states and communities and in these technical assistance communities of practice, bringing that to the research community, bringing the research findings to those communities of practice. In future years, they'll also be doing a lot of intensive technical assistance with states and communities. So I'm really excited about that work and more to come on that. But we've also, compiled a lot of the existing resources that we have on our early childhood development workforce strategy resource pages. I'll put the link in the chat for this too. There's a lot there, including both the guidance documents I discussed, some of our technical assistance resources, but also state and local program examples. So hopefully that's helpful to you all. And then we've been doing these monthly Workforce Wednesday e-blasts and webinars on topics of interest to really strengthen and support our efforts around the workforce. So I'll send you links on that. Our next event is May 31st, and it's going to be focused on promoting staff mental health and wellness. Really excited about that lineup of speakers, and I'll put the link in in the chat for that as well. So here's our contact information, and thanks so much. I think we have a little bit of time for questions, maybe, Tracy.
Yeah, I think we can, I think we could squeeze in one or two. I did want to acknowledge Star had put into the chat a really important point
Yes.
around those increases and bonuses that were part of ARPA and other state invested funding mechanisms that allowed for childcare centers to give increases to their staff. And those increases were crucial and really began to increase the wage thresholds for folks who are in this field. And so we certainly don't want to see those go backwards. That's not the right direction. So
Absolutely.
part of our organizing work is certainly focused on that. But did you guys want to speak to that?
I am really glad, Star, I'm really glad you raised that. So we, our team is doing what we can with existing dollars that Congress has entrusted us with. The $600 billion that Rachel mentioned, that's in the president's budget, that the president has called on Congress to enact for this space in both universal pre-K and expanding childcare for affordability for families and expanding in general. That that's why the president asked Congress to act on that. And we're so for the American Rescue Plan dollars, we were happy to have it. I think the field was happy to have it. It was always meant to be more of a Band-Aid in a very crisis situation. Kim and I and others on our team, we're excited about the resources that we have gotten and been able to distribute, but we're sort of like that kid outside a candy shop looking at all those beautiful sweets, and someone came by and gave me a free sample. And so I'm excited about that free sample, but in the long run, it's not going to cut it. So Star, you are absolutely right. And that's why we're really happy to be with you all today. So if we seem excited, it's because we got that first sample and we're hoping you're happy about it too. But yes, it is absolutely needed. And we're hoping that this can be a yes and situation in the long run.
And there's
Using
another. Go ahead,
Using that
Kim.
Band-Aid example, it was kind of a Band-Aid, but it feels like the Band-Aid is being taken off while we're still heavily bleeding.
Yep.
So we still need that Band-Aid.
And Star, what I would say is that part of the launch of this is an intention to really continue to push for these really necessary, not just the initial Band-Aid, but like we really need to heal the wound. And so we're really committed to it and value your participation in this coalition as we move it forward. So it's important, but heavy lift. So all right. And then Jennifer
Yeah, I can talk. Tracy, I was just going to say, I saw the notes about shared services and how important those shared service networks and other efforts like family childcare networks can be to support childcare providers, early care and education providers. That's something that we've highlighted in our strategy resource pages that I put in the link in the chat. It's something that we do a lot of technical assistance around, but we're excited about that too. And I think I just wanted to acknowledge that it's an important strategy. We know that there's also a lot of states and communities that have been working on substitute pools and other things that can allow for that break and wellness for the workforce, or someone to come in while you're pursuing your education and training. And so there's a lot of we've got a lot on apprenticeships too. I know that a lot of you all are involved in that, and so definitely recommend that you check out those resources that we have online and some of our prior webinars for Workforce Wednesday that have focused on those topics.
Yeah, and I think that comment about shared services too, it was specifically has Congress looked at that. Kim and I can't speak to sort of what congressional staff have looked at. However, I will say that like a lot of the funding that we're talking about, a good amount of it, a state, a territory, a tribe is a grantee, and a good amount of it that state, territory, and tribe as a grantee has a lot of discretion in how they use those funds. And so for all of you in your local workforce boards, the strategy, or at state level, those are really good conversations to have, not just at, at the federal level, but also at the state and even county level sometimes, so that because they do have a good amount of discretion once they have the grant funds in hand.
Thank you, Martine and Kim. We really appreciate you guys sharing with us what you guys have been working on and some of the ways in which we can advocate both at the state and federal level. It is important to remember that states do have flexibility, and that is a place where we can really begin to work together to make sure that the resources are going in the directions that we know are going to have the most impact on the ground. So that'll be part of our strategy and how we frame that as we move this conversation forward. Because we do have a tight agenda here, and we wanted to make sure we kind of covered all of the sides of this issue, I want to move on and bring Stuart Andreessen in from the Burning Glass Institute. And Stuart's going to sort of level set for us the data around early care and some of the information that we need around that. Stuart?
Of course, I'm on mute. Someone had to do it. So I hope everyone's doing all right. I think you can hear me now, just seeing a couple smiles on screen. And I believe that you all can probably see the slides that I have today. I will say that I come with quite a bit of humility, because you've already heard about a lot of the challenges that I'm going to talk about. But I think that what I'll attempt to do is kind of talk about some of the reasons that everything that we're talking about today matters, and just put a little bit of information behind some of the trends that we're talking about, and why it matters that we're thinking about kind of the overall quality of care and making sure that there's affordable care available. The number one thing is that it's a really important piece, not only for the the eventual growth and economic outcomes of children that have high quality care, but for today, for the work that parents are able to do and being able to work. And there's significant losses to productivity when we have limited care. You already heard that care is quite expensive, and I want to put a point on that. Throughout today, we're going to talk a lot about trends in the Midwest, but these hold across the country. Childcare for most families is more expensive than college tuition in 36 states. Childcare hits women at a point in their career when they make significantly less money, just under the assumption that more children are born to women in their 20s than in their 40s. There's 60% wage gain that women experience over that period during at the median, and most families spend about 10% of their income on childcare, and that's significantly higher for low-income families across the Midwest. It's not uncommon to see households spending 14 to 16% of their income on childcare. That being said, of eligible children, only 16%, so a very small fraction, receive CCDF subsidies. So we need to expand subsidies. We need to find ways to make sure that we're keeping care affordable as people have really difficult choices to make in terms of prioritizing their care for and putting a house over their head, a roof over their head. The economic impact is significant too. This number is high because of the pandemic, but between 2019 and 2021, over 15,000, nearly 16,000 child care centers closed. What does that mean when there's not care available? It means that people have to find an alternative way to care for children. In an ideal world, they're able to have a family member and still watch for children, and then someone still remains in work. That's not always the case. But when someone stays out of the workforce to help care for children, it can mean billions of dollars of annual economic impact through lost productivity that happens state by state. You can see it ranges from nearly $5 billion in Illinois to $1 billion a year in Kansas. But the numbers are really significant. If we started to also then overlay views of childcare deserts, we're going to see that those childcare deserts are often in communities that struggle with economic opportunity and persistent poverty as well. So we need to realize that these things often go hand in hand. An ability to pay for childcare leads to the availability of childcare for other families, making it difficult for low-income families to break out of challenging economic situations because they're unable to work and have their children in safe and quality childcare. And parent workers, so then if we just take a look specifically of what does it mean for parent workers, there is a little bit of a good news and bad news situation between 2021 and 2022. Parents' unemployment rate was quite low, just like the rest of the economy. Only 2.8% of parents were unemployed, and the number of parents went up, working full time went up across the board. That being said, there's still a significant need. 7% of children have no parent working. Now, that's if they're in a single parent household and that one parent is unable to work, or if they're in a two-person headed household, a coupled household, where neither parent is working. So 7 out of 100, nearly 1 out of 10, but 7 out of 100 children don't have a parent working. That creates obvious challenges for their economic situation, and it's not a small number. There's about 1 million, almost 1.2 million workers across the country that are working part-time specifically because of childcare needs. That's a disadvantage at home. If people want full-time work, it's also a disadvantage for employers that are struggling to find workers. If we had better available childcare, then we'd have more workers available for full-time work in the tight labor market that we're in. And that's a trend that continues to go on the rise. So if we look at that as a trend, there's more and more part-time workers, and it's both pre-pandemic and post-pandemic. There was obviously a drop in that number in 2021 as the economy recovered, but it's still a significant long-term trend of an increase in part-time work for care. Now, these numbers look across the Midwest, but they highlight a national trend that there's a disproportionate effect of having children on labor force participation. Women, as you can see, almost always participate in the labor force less when they're a parent with young children. And on the flip side, men almost always participate more in the labor force when they have children. And so we know that the industry itself also has struggled. We heard earlier today that there were nearly about 100,000 missing workers in the childcare sector. We did some recent analysis, and it suggests that number may be a bit lower. That's only to get back to pre-pandemic levels. If you think about kind of population growth at 100,000 missing workers in early childcare seems completely in line. We found about 55,000 workers below pre-pandemic levels. There's about 170,000 childcare jobs open annually, but it's a slow growing field. There's only expected to be about 15,000 more jobs in the sector by 2031. So it's not expecting, at least through projections, not expecting to adjust to the demands for it. For people that go into the care industry, particularly early childhood education, unemployment's very, very low. It's 3 percentage points lower than the national average. Women's unemployment in the care sector is also quite low at 1.1 percentage points below the national average. That being said, we know that the quality of work depends pretty significantly on the level that people are at, the type of facility that they're teaching at, and kind of the arrangements. And the income data that we have suggests that some of the solutions that we heard about of finding ways to share benefits and move the sector closer to what we see in the public school system could be quite good. Just on average, median wages for kindergarten teachers and elementary school teachers, is more than double childcare workers. It's near double a preschool teacher. There are some states that have started to have universal pre-K programs. Now that's just the year before pre-K, but have started to actually mimic the salary schedules that you see in K-5 teachers for those pre-K programs. That potentially accounts for some of the modest increase in preschool teacher pay that you see. But it's certainly still on the whole and on average a far cry off from kindergarten teacher wages. Now, again, I will just say that for those of you in the Midwest in particular, these are still really, really acute challenges. While there are, somewhere, let's say, between the 55 and 100,000 missing workers in early child care, the numbers are even further down and lower. These account for a lot of the drops that happened in 2021. But they remain true. There's a concentration of missing early child care workers in the Midwest. As you look at the returns to pre-pandemic levels, they're significantly higher in the Midwest, aside from a couple states that are very, very close to the national average, like Kansas. So if the nation's missing 5%, it appears that a lot of that is sitting in the Midwest. I will just say that a lot of this we pulled together, but I wanted to highlight a few things, and we'll get these slides out to everyone at the end. There's a number of pieces that help pull a lot of this story together, and these are just links that are available for that. I will say that if you have any questions or would like to chat more, I'm always available and excited to talk. And so my contact information is there. I'll turn it back to Tracy, see if we have time for discussion, but
Thanks, Stu.
thank you all.
I think we did have, yep.
We did have one question from Ruth. She wants to know, is there a measurement by state of the number of added ECE teachers needed to cover the gap in care? In other words, to eliminate the deserts. For example, based on the percentage of children with all parents in the workforce calculated by one
Like a 1 to 4.
teacher to 4 to 8 ratio needed. What is the true unmet need of teachers?
That's
How
a
many
great
do we need?
question. That is a great question, and I will say that what I was talking about, the kind of the untold part of the story that's a little bit sad is that childcare deserts existed before the pandemic. A lot of the workforce recovery data that I was talking about is just getting back to pre-pandemic levels. I do believe that we could figure that out, and probably the way to really think about that is not only at a national level, but thinking about some state specific and potentially even community specific strategies on that. To number one, figure out where are the seats that are available, are the seats that are available being utilized, and then even a metric of like how many of these are meeting our quality standards for childcare. So that might be, are we meeting the right ratios? Are these places in the compliance that we need? And we need to profile the type of ECE facility that it is. Some people are, some people want a home-based facility. Other people want something that's much more like a school environment. We need to talk through what those are. And in a community, let people know the choices that are available. So I don't think that there's a nationally available or state-specific guide on that, particularly to eliminate deserts at this point. but I believe it's doable. You know, and I would suggest that it should include not only not only seats available, but measures of quality, the types of facilities that are there, and on and on. So I think it could be done, but it's a great question.
I just
So,
wanted to chime in that we do have a guide that is not the guide on that, but we do have a ACF USDA Rural Development Joint Guide on rural facilities. So I'll put that in the chat. It's not the answer to the bigger question, but it's one tool.
So again, thank you guys so much. There's so much. I think one of the things that has been most interesting to me as I've worked through this and continue to work through this issue is just how complicated it is, right? There are so many sides to this that that we need to really explore and understand. And so the data is a really good place to start. This will be an important part of the work that we do together. And so I see, Ruth, your question here. Just because of time, we're going to keep moving, but we will continue this dialogue, and these specific questions we will add to the research that we're looking to do around this to make sure that we've got our hands around stuff. And Kim, thanks for dropping that in the chat. Stu, thank you for covering that data for us. And I just wanted to bring our next presenter into the conversation. So we have Hawaida Hassanin, who has been operating an early care business that includes both childcare as well as training. And so she's going to speak a bit about her experience operating that center and some of the challenges that she's experienced along the way and solutions that she has looked to pursue.
Thank you, Tracy, and thank you for including me. We currently own 5 daycare centers, and we have consistently seen, as well as other centers that we're also, associated with, that we're all struggling to retain staff. And then the staff that we do find, we find that they are unqualified or lack training and experience. I was just at a conference just recently this past weekend, and I was actually sitting right next to the deputy chief of the licensing branch. And he was sharing with me that currently between this year and last year, that we have doubled in the number of children that are left unattended, children walking across highways, children being left on playgrounds, children being left on buses. And it's because we are struggling with finding qualified staff to put in classrooms. I currently have waiting lists at all of my locations. I have classrooms that I can't open because I can't find teachers to go in there. It's like we're just waiting for something big to happen. It's like there's going to be a huge cry when we start to see, unfortunately, the number of deaths that are occurring in childcare. And it's very frightening. I've been doing this for 30 years, and I never thought that I would have to shut down my classroom doors because lack of finding qualified and experienced teachers. And if we are fortunate enough to find a qualified staff, the public schools are grabbing them up, right? So now I'm competing against public schools that have benefits and better time off and better pay. So it's a very trying time for us, and we kind of are, I don't want to say the word underappreciated, but without childcare, the country can't function. Doctors, nurses, we were one of the few centers that remained open the entire pandemic. And that involved me asking my mom to come back to work, my brother to come back to work, my sister to come back to work. Because we knew if we didn't, doctors couldn't go to work, nurses couldn't go to work, EMTs couldn't go to work. And it's like we keep trying to, express our voice, and it's like we need to be heard. Now we're at the point where we're falling apart. We are breaking at the seams, and we really just need that additional support to continue. And I'm looking at all the chats, and I'm acknowledging as well that like they said, it's that ripping off that Band-Aid, right? When we're still in bleeding mode. And, you know, Tracy, I can't thank you enough, and everyone that's here and, you know, trying to hear what we're saying and hopefully making the steps and progress that we need to kind of help childcare providers across the country to stay open and to stay, you know, in compliance with qualified staff. My other hat that I wear, or my other scarf that I wear is I also own a childcare training center. And so I kind of see both sides. You know, at this point, we are even offering training for free. We just got a grant that we are providing, you know, child development associates to providers who would, you know, would just like to come into the field and do the training. And we're offering them a monthly stipend just to continue the training and giving them a laptop to be able to do it from their homes. So we need more programs. We need more grants like that to kind of help expand education into more homes, to bring more, you know, moms that may or have been on the cuff of thinking of coming into childcare, and just kind of giving them that opportunity. But thank you.
Thank you so much for sharing your experience with us. I know that you have been really active in advocating for quality standards for the industry and making sure that the industry is well represented in all of the conversations that are happening. So we really appreciate you joining us here today. Are there any questions that or comments that folks would like to bring in now? I think people were super grateful just to hear your experience, Huwaida, and the challenges that operators have in this space. So, all right. I'm just going to give folks one more minute here. Do a little run through. All right. Well, thank you so much. And I'm hopeful. I know that you have many hats or scarves that you wear. But as we continue this conversation, making sure that we're centering the voice of those people like you who are, you know, really doing everything you can to keep this industry moving forward and advancing, that you'll remain part of the conversation. So thank you so much for joining us. All right, I think we're going to move on next. We wanted to make sure that we included the experience of not just a business owner, but also of folks who are working in the field as well. And so we have Mimi, and I'm going to butcher your last name, Mimi, so help me out here. And Bree Rice, who are going to talk a bit about their experience. I'll sort of anchor where we're headed here. So in the Pittsburgh region, there was a movement to implement registered apprenticeship as a workforce strategy, and that work grew out of partnerships with the workforce system and community college and Carlow University, and they were able to implement a tiered apprenticeship program that took folks from a CDA to an associate's degree to a bachelor's degree. And so we're glad to have Mimi and Bree here to talk a bit about the experience of being part of that program and working in the industry specifically. So Mimi, off to you.
Thank you, Tracy. So I'm Mimi Lawhead, and my position at Carlow is the Southwest Workforce Apprenticeship Coordinator, and we have our center is called the Dr. Rayanne Hirsch Apprenticeship Hub for Early Childhood Education. So I'll just quickly kind of tell you about our model and what we've been doing. We started with a pilot program in 2019 with 20 students, 20 educators. and from 2 early learning programs in 1 county. This fall, we had 150 students from 74 early learning programs and across 6 counties, including several rural counties too. What our model is we have, it's really designed to reduce the workforce barriers to educators getting credentials or degrees, also building diversity in the pipeline, and then also increasing the higher quality being provided to children and families. We provide our apprenticeship program, as Tracy said, by coming to Carlo, students can get their CDA credential. We're also working with Westmoreland County Community College. They can get their associate's degree there. And then at Carlo University, they can get a bachelor's degree. And we have 2 tracks. One is early development and learning. And then we also have a pre-K to 4 certification track. So with that degree, they could teach in elementary school or in pre-K counts classrooms, which we know those teachers need to have certification. And there's such a shortage, particularly in our area. We know there's a real shortage of pre-K counts teachers. So those are the tracks that they can take. The requirements are that they're working at least 25 hours a week in a licensed childcare program, early learning program, Head Start or pre-K counts. And they have a high school diploma at least or a GED. The way that we really reduce the barriers is one with the coursework. We provide it in a hybrid model. We have evening classes and online classes, and then students also take up to 8 on-the-job courses. So that's part of our apprenticeship model. So they get to take those courses, you know, on their site. They have an on-site coach. So they're working with what they're learning content-wise. They're being able to apply it immediately in their classrooms, talking with their coach, their experienced person in their early learning program. And we find that's a real strength. One of the other big factors we have is that every student is assigned a university mentor that they meet with weekly. And that is just all of the different data we've been collecting. That is such an important part for them to have that person to connect with, to form that relationship with, to help them through coursework, to help them obtain, you know, mental health services that are at Carlo, extra academic support, really just kind of all-round professional support, career counseling, sort of everything. They're kind of the everything person to the students. Another barrier that we reduce is Pennsylvania has the early childhood PDO at PASHE, which is through OCDEL, the Office for Child Development and Early Learning. They were in the 4th year. They provided funding, and Carlo became a partner with them, along with about 23 other higher ed institutions and some community partners. So for Carlo, students can receive up to 18 credits a year of free tuition, as long as they're working in a licensed childcare for 25 hours a week or more. And that covers their tuition, their books, all fees. So basically a no cost program for them to get towards their degree or their CDA credential. So we found that's a really big factor for our students. We know most of the workforce has very low pay. So being able to provide that has been really critical for students to come back to school. You know, we have students that are working and, you know, have come right out of high school and gone into childcare. And then we have people who've been in the field for 30 years. We have a student who is my age, so she's older. She's in her 60s and she's gone back to get her bachelor's, you know, after being in the field for like 30 years. So we really feel that's a big benefit to our students. I think one of the things we found, you know, we've been working with the Department of Labor and the registered. We also have non-registered apprentices because we find, particularly in some of our communities of color or some of our rural communities, they're very small programs. They can't meet the ratios that are required The employers can't meet the wage increases, so we offer both because, you know, we really want this program to be available to everybody that needs it. Yes, students can get teach funding, also Rising Stars funding. You know, I think we've seen that it's really helped with staff retention. One thing that we do, I think that's unique too, is with if students are in the teacher certification track, a big barrier has been, you know, how do you leave your job for 16 weeks to go student teach somewhere? These early childhood educators don't. So we've worked with the Department of Ed that they do a 1 month primary practicum in an elementary program, and the rest of the time they can stay in their child care center for their student teaching. And for the month that they do leave, we provide a stipend to the teacher for what their take home pay would be. We also provide a stipend to the early learning program for however they can figure out to pay for coverage of those hours. We know that there aren't a lot of staff or substitutes, but we want them to be able to be compensated for that too. So that is our model. And I'd really like to introduce Bree Rice. She's one of our apprentices that we are so proud of. She's about to graduate, and she is a prime example of the type of professionals that are in the field that have chosen to be in this field, even though they don't receive a lot of pay and they don't receive that status of being a professional and being, you know, experienced and taking care of our future. So I want to introduce you to Bree.
Thanks, Mimi. That was great. But with this, we are going to change that so that we are looked at as professionals, because that is definitely a way that we as this community are going to change that. And this Carlo program, I am so pumped about. I can't say enough great things about it. But my name is Bree Rice. I work in a privately owned childcare center in North Huntington, which is a suburb of Pittsburgh, Pennsylvania. It is JB's Bright Beginnings. It's been in practice for 17 years now. I've been here for 15 of those. I worked for over 10 years in a classroom, which I love. That is definitely where my heart is. Working with children, that's my passion. I know that that is the calling I have on my life, but I now get to work in administration. So I get to work on the other end. I am the program specialist here, which means I get to work with the families, I work with the children, and I get to work with the staff. So I'm super excited about that. Our child care center is licensed for 355 students. We currently only have 144. Most of it is because of staffing. We don't have enough staff to open up the spaces that we have. We would love to. We have run our facility at full tilt in the past, so we have the capability of running a large child care center. However, with staff, we do not. When asked to speak, it was like to talk about post-pandemic, but let's be honest, childcare has been in crisis way prior to the pandemic. It's just now on the forefront and everybody else's, because, you know, we in this industry, we have the unique ability to help and serve other industries. You know, those other industries that help support our government and funding, they need us because we're taking care of their little ones. You know, we are here at JB's Bright Beginnings, a Star 4 Center, which is our quality program in Pennsylvania. And so we have reached the top and we have worked really hard to maintain that. But with that, that means you have to have that qualified staff. We are lucky here. We have 23 staff members. 8 of those do have a bachelor's degree, 5 of them have a master's degree, and the rest do have either their CDA, their associates. And we are lucky enough to have 4 staff members, myself included, in the Carlo Apprenticeship Program, because we understand what high quality means. And with the pandemic coming out, our families have changed. Behavior has changed. So our staff needs to change. So we understand that. And with the Carlo Apprenticeship Program, it's affording us to take some of our younger staff members who want to have that knowledge and they want to do that. And we're giving them the opportunity to do so. As Mimi said, the on-the-job classes are absolutely amazing. I've been in the field for over 15 years, and yet when I got to my on-the-job classes, it was awesome. I was able to learn and then implement immediately and then take back questions that we had and we could discuss as a group how to make changes in our classroom or what we needed to do. Our families, are changing. The dynamic of the way that a family looks today is completely different. We have way more children in our center who are a part of the foster programs, who have only one parent or who are being raised by grandparents. It's just different. Children have seen things that, children 10 years ago did not see and are dealing with different things now than they did before. So trauma is a big thing that's been happening. So we are trying to make sure our staff is educated and that we can continue to move forward with that as the professionals that we know that we are. So with that Carlo apprenticeship model, it's just really helping us. Like, it's helping us to use that as a retention part of our and to onboard staff that, hey, we have this program here and you can earn this and we're going to walk you through. Our director is actually a mentor in the program, and we have one of our other fellow teachers as a coach in the program. So we support it the whole way around. Like I said, I just can't say enough about it because of what it's done for me. Being in the field as long as I have, I've always wanted a degree. I feel I'm an educator, which means all I want to do is learn. I want to keep learning what the new thing is, and I want to be able to be the best that I can for the next generation. However, I knew I couldn't afford it. I worked here because my husband could support my family, and this is what I was called to do, and I was able to do so. Without that, I wouldn't be able to. And then to tack on $120,000 worth of debt, there is no way that was going to happen. But when this Carlo apprenticeship program came in, it was the easy answer to it. And now we're able to help build our staff so that they're stronger. And I really feel like that question earlier about how we get others to look at us as professionals, I feel like this is one of the ways. We're educated just like every other field. We have degrees, we have those things. So we are professionals and we are doing this job. Childcare, as we know, that a child's brain develops the most between the ages of 0 and 5. That is our little niche. We get to take and be a part of that child's, upbringing and how they're going to develop and what's going to happen. How more important of a profession do we need to have than that? They are our future and we get to work with them. So I'm just honored and, super excited by this conversation and that it's being brought to light in a different way across our country. And, and this Carlo apprenticeship program, the model I think is fantastic. And I think people need to go onto it and start to imitate it because it has changed our lives here as a center. It definitely has changed mine. So I am super, super excited about it and honored and just privileged to be able to be here and share my voice a little bit. So thank you.
Oh, man, that was fantastic, Bree. I think you got everybody all fired up. And I know that it's the passion that we can hear come through your voice that is what fuels you to keep doing this really important work. And it really does take a village, right? And we're here to support you and to lift that up and hold that up so that we can replicate the models that we know work. And we know that the Carlo model is a model that works, and you're definitely evidence of that. It looks like there are some comments coming through in the chat.
Can I add one quick thing?
Yes, please do.
As she was talking earlier about the supports, that is something also that program, it is superb. Financial aid questions, because it's confusing and you got a lot going on. They were right there to answer and help. Having that coach and having that mentor, huge deals, because there are so many things that the university as a whole offer, but to find them, it could be challenging and overwhelming. But that mentor was able to just direct us in what path we needed to go and how we needed to do it. And as far as even our classes scheduled, there's every little part of it, which really does lift that off, because you are taking college classes. So it's still a lot of work. It's still a lot to do, but they take some of that burden off and just lift it up a little bit to make it more doable while still working, because let's face it, we're all still working 40 hours or more a week while doing this, because we want to improve and we want to be better and we want our field to be held, at a higher standard. So I can't say enough about those supports either. They really do make a difference in the whole aspect of the program.
Absolutely. Thank you for that. I really, really appreciate it. Any questions or comments? beyond what we sort of see in the chat. I Star 100% agree. You know, my daughter is a Head Start teacher, and she reminds me all the time that you know, the social and emotional learning that she does with her birth through 3 classrooms is really the foundation of their learning. That is what's making their little brains ready to do all of the complicated things that we learn and develop as we grow into adults and future workers. And when we say early childhood educators, that's what we need. And so it doesn't matter if you're teaching in a 5th grade classroom or you're teaching in, you know, in a birth to 3 program. We are educating those little minds, and it's crucial work. All right. Let's see. Kim put some additional, and that's right, it is Teacher Appreciation Week, and I owe my daughter some flowers, so don't let me forget that, and to say thank you to all those teachers who are on here.
And I just wanted to say it was a big deal to see the language about early educators in that proclamation. So thank you guys. I think that was good news to see.
Absolutely. Thank you.
And I would say in our Carlo program, we have probably almost half of our apprentices are birth to 3. So, you know, we need to focus too. I mean, the preschool and the pre-K counts and all of that is, you know, is critical, but so are those birth to 3 years and those educators.
Absolutely. Well, I think one of the things that Bree pointed out as she was sort of sharing her story was the important role that this industry plays to support other industries. So, you know, we saw during the pandemic just how critical it was to have the frontline workers in the early care space available to support those folks who needed to go work in the hospitals to care for people who were sick. And the challenges that parents themselves had when they were trying to educate their children while also doing their day jobs. So certainly there are other industries that, you know, rely on access to quality care. And I am really delighted to have Anjana Radhakrishna join us today from the Manufacturing Institute, which is part of the National Association of Manufacturers. And certainly this is one of those industries. Every other industry is reliant on early care, but in the manufacturing space specifically, you know, because they are running on shifts and because of the type of work that's engaged, you know, it's even more challenging to make sure that their workforce has access to the resources that they need. So Anjana, I'm going to let you talk a bit about the work that you guys have been engaged in and share a bit more about your experiences as well. Thank you.
Thanks, Tracy. Hello, everyone. It's been so great to hear perspectives on childcare today from government officials and researchers, and most importantly from educators and childcare workers directly today. So as Tracy mentioned, my name is Anjana Radhakrishnan. I am the Associate Director of Workforce Insights and Research at the Manufacturing Institute. And I'm here today to provide the employer's perspective on childcare, which a couple of our previous speakers sort of mentioned this, Bree, and I think also Congresswoman Bonamici, about how while childcare has always been an issue and very much a crisis well before the pandemic, I think post-pandemic, with a lot of the other factors that are going on within the economy, it has risen to the surface in circles that may have previously not have valued childcare to the level that it should have been. And so that's sort of the work that we've been doing at the Manufacturing Institute. And so to get to that, I'll be discussing some of the macro level trends that we're seeing in the economy, which Stuart from the Burning Glass Institute really did a phenomenal job diving into some of this data earlier in the panel. So I'll do my best not to overlap too much here. And I know also that this audience here is very much aware of these data and the crisis at hand, but I think the points cannot be emphasized enough in terms of how critical childcare really is to the larger economy. And so before I get into that, let me just start with a brief overview of my organization and how we're entering into the conversation. The Manufacturing Institute is the 501c3 Workforce Development and Education Affiliate of the National Association of Manufacturers. And our mission at the MI is to build, strengthen, and diversify the manufacturing workforce of today and tomorrow. And so we do this by connecting groups, much like Midwest Urban Strategies, different players within the space, whether that's employers, government officials, community-based organizations, through that shared mission of building a resilient manufacturing workforce. And so we do this through a range of work, including implementing groundbreaking programs, convening industry leaders, and then conducting innovative research. And so given our unique positioning there, we're really dialed in on the issues that the manufacturing employers are facing. And so over the past couple of months, and really since the pandemic hit, we have been hearing from many of the manufacturers that we work with that childcare is one of the top concerns that they're encountering as they're attempting to build a workforce that can meet their production needs. And so knowing that this is an area of concern, not just for manufacturers, but for companies across the economy, the MI has been leading efforts to identify and amplify solutions that are happening within that employer space, right? Like, what is the private side of the economy and the society really doing to try to address this childcare crisis that we're facing? And so we're actually working on 2 case studies that showcase the work manufacturers have been doing to address this challenge. So I'll talk a little bit about that as we're kind of moving through this little discussion. And so, yes, as I mentioned, I'll be framing the childcare crisis from the macroeconomic and employer perspective, and then share a few examples of the solutions we've seen trying to address that childcare crisis. And then I'll end with a couple of ways you can get involved. So let's start with the state of childcare. You know, the childcare crisis we're facing has been shaped by several macroeconomic forces, and that's been exacerbated specifically by the pandemic, this shift to more flexible and remote work options, as well as the rebounding economy that has been intertwined with inflation. Of course, even before the pandemic, childcare was inaccessible for many people within American society, with long wait lists and ballooning costs. But then at the outset of the pandemic, the childcare industry lost 1/3 of its workforce, and it has not recovered. As Congresswoman Bonamici mentioned, you know, there's been a loss of 100,000 fewer childcare workers since the pandemic. And this trend has continued. It's continued to drop off even as we've been coming out of the pandemic, even as we've recovered, as Stuart had mentioned, to 94%. There were about 58,000 fewer daycare workers in the US last month compared with February 2020. And so what does that mean? That means when we have less labor available, that means higher costs. And that lack of affordable and accessible childcare impacts employees' abilities to participate in the workforce, as Bree had mentioned. In many cases too, it makes more sense for a parent to exit the workforce and take the loss in wages instead of paying those high premiums. And that exodus contributes to the tight labor market, which then puts pressure on companies to increase wages, to attract labor, which then increases production costs, which then increases the prices of goods and services, and then we're in that inflation spiral. So yeah, the bottom line is lack of childcare, that's a core driver of inflation. And solving childcare is not just a problem that affects working parents, it affects all of us. And so, yeah, as I said, that labor market is very tight. In fact, the latest Manufacturers Outlook survey found that the inability to attract and retain talent continues to be one of the top primary challenges. And there are significantly more job openings and there are people who are seeking employment. So there are 9.9 million job postings in February with 5.9 million unemployed Americans. So that means for every 100 jobs, there's only 60 unemployed workers looking to fill them. So that, again, really contracts the labor market. It raises prices, it raises inflation rates. And so what does that mean for employers too? It also means there's a lot of lost opportunities. So, as mentioned earlier, childcare is that significant driver of that reduction in labor force participation. And interviews that we have been conducting with manufacturing leaders have revealed that lack of childcare is hampering the hiring of qualified candidates. So again, even if people are willing to work, they're facing that high cost of childcare, the inaccessibility of childcare, and they're unable to contribute to the economy. And so we see that this has much greater effects. And we also know too that, of course, as a couple of the other speakers mentioned, I think Stuart showed us some great data on this. this impacts women more than men because of, unfortunately, the gendered structures of our society, right? In a recent Manufacturing Institute study that we conducted, 49.2% of manufacturers reported that a lack of childcare support was the top labor force challenge heard from female employees. And we're facing an average of about 800,000 open jobs a month in the manufacturing sector, which means, that absence of both female and other workers from the labor force is really felt acutely. And that's not just in the manufacturing industry. Bank of America did a study recently where they estimated about 380,000 Americans in their prime working years, that's between ages 25 to 54, held jobs before the pandemic, but no longer did late last year. So again, one of the key reasons that they identified was because of that lack of affordable and quality childcare. And then I'll give you two more quick stats here, because I know you all know that this is a problem, but I just kind of, like, when I was preparing for this, I was just, again, struck by how obvious this is a problem and how clearly we need to address this. So I'll give you two more points. A Federal Reserve report showed that a lack of available childcare is the top reason for impeding labor force participation in many parts of the country. And then a Census Bureau survey conducted in mid-February said 4.9 million people missed work because they were caring for children not in daycare. And so that's, let's even say you're still working, even if you do have childcare, or even if you have children. There are still days that you're missing from working because you don't have that emergency backup care available. And so that, again, that impact is just, it's so great within the economy. And so, addressing the childcare crisis is crucial for employers. And so that's what we've been finding at the Manufacturing Institute. And so what are some things that employers are doing to address them? So we know for, larger manufacturers, they've been going down the route of providing on-site childcare, which is also part of the CHIPS Act, which Rachel West from the White House kind of talked a little bit about how the CHIPS Act is, requiring manufacturers to provide on-site childcare if they want to receive that grant funding. And so other companies are also kind of following suit. They're providing on-site childcare, especially in areas where there's very limited options or there's childcare deserts. And then, employers in those situations oftentimes partner with the company to outsource the administration and operations of the center, as well as advising on the construction of those facilities. Once those centers are built, tuition rates are often subsidized by employers, and some offer scholarship programs for employees under a designated income bracket. And so this solution can really have a high impact. Companies who have made this investment often see it pay off with lower absenteeism, high employee satisfaction, and it really helps attract and retain talent, especially in a economy where childcare is so hard to access. And so companies see this as a way of providing really a tangible and visible example of commitment and willingness to invest in their employees. However, as I mentioned, this option can be much more difficult for smaller companies who may not have the resources and the staffing necessary to launch such an extensive program. But this is something that manufacturers and other companies in the industry or in the economy are trying to do to address this crisis. Another option is we've seen companies investing in nearby childcare centers, whether that's renovating the facilities or reserving a certain amount of spots for their employees. So while that doesn't really get to that sort of the childcare shortage aspect, it does try to alleviate the childcare needs of the employees within the companies itself. And so sometimes companies have even partnered together to try to help keep childcare centers from going out of business, particularly in those rural areas where there may not necessarily be as much support for those childcare centers. And so in some cases, certain companies will pay full tuition at those facilities for a certain number of employees. And then, as Tracy mentioned, for manufacturers who have to work second or third shifts, companies may work with existing childcare centers to provide services during those shift hours. And so I think really that's sort of like that where's the money coming from? Sometimes it's coming from the companies and they're able to invest it in those childcare centers and try to expand to provide the support that their employees need. And then another thing we've seen too is like providing discounts and memberships for childcare centers. And that's kind of like on the lower end of the spectrum of what employers are able to provide. And then, of course, they provide benefits such as parental leave and emergency backup care. And so those two can try to address, you know, with the childcare crisis going on, being able to support those needs. And then another aspect that we've also been kind of exploring and delving into is addressing the childcare crisis by offering more flexible schedules, whether that's formal or informal. And so some companies have been creative with that. One company we talked to offered shifts that started 30 minutes after school started and ended 30 minutes before school ended, so that parents could work during the time that their children were in school. We've also seen companies offer things like 6-hour work weeks, so that they're able to, again, kind of manage their family obligations in addition to their work obligations. And then swapping shifts, especially if, you know, children are sick or on break. And then having informal policies of allowing, you know, parents to start shifts later or earlier to meet their family obligations. So that's, you know, just kind of an overview of some of the solutions that we've been seeing to the childcare crisis from the company side. And I think there's a lot of opportunities for us to partner with educators, government officials here to try to expand those offerings. Because I think this is definitely, much like other people have said, this is kind of like a Band-Aid solution that doesn't really solve the systemic issue of childcare that is causing the crisis within the US right now. And so I think it's definitely a starting point. It's good to see that companies are providing those opportunities and trying to address those issues, but I think that it needs to be a part of a larger solution. And so, yeah, you know, as I said up top, you know, the childcare crisis impacts us all, and especially through the effect in the labor force and the larger economy. And it's not a problem that's going to go away on its own. It's going to require solutions and a coordinated effort from all of us. And so employers who have been addressing the crisis in a different set of ways, they've seen success, but it's a question of how do we scale those solutions? How do we make that accessible to companies of all industries and sizes? And so to, you know, answer some of those questions, the MI, we are hosting a workforce summit in Atlanta from October 16th through the 18th. I'll drop a link in the chat if you're interested in some of these more workforce related topics, and kind of getting ideas from a different industry as well might be helpful. And then also we do, if you're interested in kind of keeping up with these more macro level workforce trends, we recently launched a newsletter called Workforce in Focus, and I'll drop my email in the chat too. And if you're interested in kind of keeping up to date with more like those macro economic kind of trends, that might be of interest as well. And so, yeah, thank you again for all the great panels. I've learned so much from everyone, and I'm happy to answer some questions.
I think this was fantastic. Thank you so much you covered a lot of ground in very short order. And so thank you so much for that. One of the things that I'm curious about, and I do see I see a question here in the chat that we'll come to in a second, but has there been much conversation yet about the requirement in the CHIPS funding to work around the childcare issue? Have you heard any feedback on that?
Well, I do know that I think so. From what I've heard, we haven't talked to too many semiconductor manufacturers recently since the CHIPS Act has passed. But I'll tell you what my general sense is manufacturers understand there's a lot of benefits, not just in providing the childcare for meeting the grant, but in attracting and retaining that workforce. They know that if they do provide that service, folks are much more likely to remain loyal to the company and stay longer. And so there is that added benefit that I think is a motivating factor for companies as well.
That's great. And so I believe that you said that there are some companies that are offering as part of maybe a benefit offering some sort of support to parents or caregivers. Is that something that you see as a growing option? And there's Ruth has here in the chat a point about having an IRS ruling that would allow for employers to pay retirement match on childcare payments and other sort of mechanisms such as that. So any thoughts on that?
Yeah, I will. So I will say, I think as the economy shifts post-pandemic, there's been so many changes that manufacturers have had to become much more nimble and much more willing to explore options that they may not have been willing to before. And so I definitely think, especially with a very tight labor market and how competitive it is to try to get workers into their companies, there is much more openness. I think of course, not all companies, but I will say in general, I do see a much more openness to addressing issues like parental leave, emergency backup care, like elder care. Like these are things that companies are definitely talking about and considering and actually taking action, making those into policies for their employees. Definitely much more so than I think pre-pandemic.
That's great. So it looks like there's another reference here. And we'll get all of these links organized and all of this information shared out so that that we all are on a level playing field in terms of the information that is out there. Are there any other questions or thoughts? More conversation happening here. Anjana, thank you so much for joining us, and we look forward to continuing to work with you. If share out those dates for the October session, I think it would be great. Really kind of connecting industries together is one of the ways in which we can best begin to bring long-term solutions to this problem that is bigger than any one of us. So thank you so much. So we are nearing the end of our time together, and this has been a fantastic conversation. I am really humbled and grateful for all of the work that is being done on all of the different sides of the industry and the work that is being engaged in every day to fix the challenges that impact our ability to effectively provide care and education for the youngest of our society. And this is work that, this is passion work, as Suzanne will say often. We're in this because this is an issue that we collectively, those of us who are part of the planning team, we really think is necessary. And we need to have all of these voices around the table to really advance smart policy, to hold up promising practices, and to really problem solve together around local solutions to these local problems. We are going to continue this work. And so following this conversation, we will send out an email and invite you to continue the conversation with us. And so please be on the lookout for that email. We will be forming some work groups and then working towards an in-person conversation that will help us really develop our platform, if you will, that we will use to guide the work as we move forward. We've talked about this as a three-legged stool. So the first leg of that stool is the early care businesses that are engaged in providing those services, living within the regulatory guidelines, maintaining the ratios, all of the things that go into running an early care business, whether that is a for-profit or a nonprofit part of a school system, however that is structured, whatever funding mechanisms it utilizes, those businesses operate on slim margins across the board. So how do we use things like shared services and other strategies and tactics to help those businesses be more effective and efficient in providing their services? And how do we make sure that, JV's Bright Beginnings has enough workers so that it can meet the needs, because those childcare deserts are real things, and they exist because we need to have the workforce in place to meet the needs of those children. So the second leg of the stool is that workforce, and we need to make sure that we're able to provide them with a quality job that offers a livable wage, has access to benefits, that they are understood to be professionals in the work that they're doing, that they are supported in the work that they are doing, that they are able to advance and share their voice, not just with the children that they're teaching, but this broader community of practice as well. And then lastly, those other industries are that third leg of the stool, and manufacturing is one of them, construction, financial services, the healthcare industry, my gosh, it goes on. So we have to have all three of those pillars as part of this conversation, and we will build work tables around those pillars to advance this work together. So I hope that you will consider joining us in this mission that we have to really change the conversation so that we center those three pillars in how we advance the work that we know needs to be done. Band-Aids are necessary when you've got a cut. You know, we have to have a way to cover it and to make sure that it doesn't get infected and that we're well. But what we don't want to have is just a bunch of Band-Aids holding together a gaping wound that maybe needs some stitches and some antibiotic cream. So we're really working to bring all of the sides of this solution together in that conversation as we look to advance solutions. And I will leave you with this, and I was reminded of it by a colleague, and it has just stuck with me, especially with this early care conversation. And it was something that President Obama was known for saying, and that is that we have to stop admiring the problem and we need to start solving the problem. So that's what this is about today. We are going to start to solve this problem together. And I really appreciate you for joining us in this conversation. We will see you all again soon. Have a great rest of your day. Thank you again for joining us.